Hey, so tuberculosis. I have had to get a TB test a couple different times working or volunteering in the hospital. Never really knew really what it was. One day I was working as a CNA at Otago Medical Center and I saw this room under quarantine and it looked like the end of ET where it was taped off and had this separate ventilation system. It was exclusive, this authorized personnel only situation. And I was like, I gotta see what this bug is all about. So tuberculosis is a species within the Mycobacterium tuberculosis complex, and they're slow-growing, acid-fast, broad-shaped bacteria that are obligate aerobes, most commonly acquired through inhalation, so it is an airborne infectious disease. Myco refers to it being fungus-like. It has a waxy, water-resistant outer layer and kind of grows in these clumps. It looks a little bit like a fungus in that aspect. And due to that high lipid content in the cell walls, the bacteria are actually very resistant to drying, disinfectants, and antiseptics, and can actually survive in dried sputum for weeks. Symptoms are a bad cough that lasts 3 weeks or more, and that cough usually is bloody, with phlegm involved. And in the old movies, you see people dying, they're coughing up red blood, and this is like the typical tuberculosis. People also have pain in the chest, weakness, weight loss, and low appetite, and they can also have chills and fever and night sweats. Tuberculosis is spread through the air, and hence that ventilation separate quarantine that I saw. And when a person with TB breathes or coughs or even speaks, that bacteria is sent into the air and can be breathed into the lungs of another person where it can begin to grow. And it can be present in other parts of the body, such as the kidneys or the GI tract. And those forms are usually not contagious. Yeah, this disease can actually take place almost anywhere in the body, like the skin and the bones. Diagnosis of tuberculosis usually involves a chest x-ray and lab examination of smears, but these smears are not always accurate because this bacteria is slow growing. A large enough sample to actually show up under the microscope can sometimes take weeks to acquire from the lungs to look at it underneath there. So they often will use nucleic acid amplification tests and utilize that PCR we learned about to amplify and therefore identify this bacteria. And it can lay dormant in the body if it's breathed in, if the body is able to fight off that bacteria or kind of defend itself. And people with latent TB usually have positive TB skin tests, like shown in the picture here. That little bubble will turn red and puffy, but they will not have symptoms. They won't feel sick, and at this time they're not contagious. But it can develop into an infection, and that is usually if somebody has a compromised immune system or if they do not receive treatment. And therefore, it will then turn into TB disease, and this only occurs if your immune system cannot fight off the growing bacteria. There is a vaccine called the BCG. I'm not even going to attempt to pronounce that, somebody's name, and it is used for tuberculosis in children, especially in areas where it's very common and where they are in constant contact with an adult or somebody else who is infected. And it is not used often in the U.S. because it's not extremely effective. Pathogenesis. So this is what it looks like in the body. In this first picture, you see the line here for the alveolar macrophage. And within that cell is the little tiny black line, and that is the tuberculosis bacteria. It has been breathed in to our lungs, and it's in those little alveoli, and that macrophage has engulfed it in an attempt to get rid of it and defend our body. But it can usually survive inside our cells. So inside that macrophage, it begins to multiply, and you see here in image 2 where more macrophages are brought in. That's our immune system attempting to fight that off this bacteria. And from there, it begins to form kind of a pre-tubercle. And yes, tubercle tuberculosis, that's where it comes from. And this little kind of blob secretes these enzymes, and it causes inflammation in our lungs, and this is actually damaging to our own tissue. And then in this third picture here, you kind of see where it has caused a little bubble, and inside there, it's those those bacteria cells are surrounded by our dead macrophages, and it causes this little environment that's actually anaerobic. And because these are aerobic bacteria, this really slows down their growth. And at this point is where latent TB can take over, and this is where it can be sitting like this for years at a time. So this person is not having any symptoms, but they are testing positive for tuberculosis in their system. And in this fourth image here is what is referred to as a true tubercle, and processes we won't get into, but the next step is air is then able to enter the system, and within that little bubble, that's when the tuberculosis bacteria are really able to just multiply and grow uncontrollably. And then the final picture you see where it has ruptured and all those bacteria have entered the bronchiole, where they're into the lungs, and then from there they can enter the circulatory system, and that's where things really start to get nasty. Not just the thing of the past. Consumption is the word that they'd use in movies and show the bright red blood and the handkerchiefs, and that was tuberculosis. So it was real. It was responsible for 20 to 30% of all deaths in 19th century Europe. Reading that totally blew my mind. And today it's commonly a co-infection with HIV due to that increased susceptibility, and exposure to this bacteria rapidly turns into the active disease state. The strain of that bacteria is the M. avium intracellulaire. Not very common in the general population, but that does seem to be the one that is occurring most often in the HIV population. There's also a peritoneal TB, and that is a disease that is specifically in the intestines and the abdominal cavity, and due to consumption of unpasteurized milk. The strain responsible for that infection is the M. bovis, and it is what they call the bovine tuberculosis. Rarely spread person to person due to the location in the body, and it is uncommon in the United States because of our pasteurization processes. So what really stood out to me was the treatment for this infectious disease. It is a minimum 6-month therapy, and to minimize resistant strains, a multi-drug treatment is used. And one of the first-line drugs is rifampin, and it's the big molecule shown on the screen, kind of the iconic antibiotic used for tuberculosis. And if that strain is resistant to the first-line drugs, some of these second-line medications are used. And they're not used initially because they are either less effective or they're actually toxic to us. And in some countries, they're not even available. So the therapy is so long because the bacteria grow very slowly, and they exist in these difficult-to-reach places. I mean, they're inside some of our own cells, and antibiotics, if they can even reach them, some are not effective on these dormant cells and are actually only useful if the cells are already replicating and are active. And in 2016, the overall mortality rate was 12.3%, but it is worth noting that most of these deaths were patients who had some comorbidities, so cancer, liver cirrhosis, and renal failure. So there is a big part that has to do with this compromised immune system. The perfect candidate for phage therapy, you say? I agree. So because it's such a slow-growing bacteria, it gives plenty of time for the proper and specific bacteriophage to be identified that can treat this infection. And because the phages can penetrate places in the body that these antibiotics cannot, I just feel like this is the ideal time to try out these alternative therapies. And because it's highly selective, these phages can hone in on the target cell and remain in the body, in theory, as long as tuberculosis cells are present. So it would likely require shorter periods of treatment, or at least a decreased number of therapy sessions, at least compared to the current treatment schedule. And with the history of this antibiotic resistance, and knowing that phages can mutate on their own to infect the bacteria that have become resistant, I just feel like this is an awesome chance to do our part in decreasing this antibiotic resistance epidemic. And a list of the geniuses behind all my facts and images. So thanks, guys.